My name is Dr. Warren Hammert. I'm a hand and upper extremity surgeon in the Department of Orthopedics at Duke Health. My practice involves treatment of conditions really below the elbow, so the forearm, the wrist, and the hand. I treat children of all ages as well as adults of all ages, so from birth to elderly individuals. Treatment involves all kinds of conditions involving the upper extremity, congenital conditions such as children born with extra fingers, without fingers, duplicate thumbs, variety of things from that. Other areas that I have interest in are wrist reconstruction, whether that may be arthritis, whether that may be instabilities from a ligament injury, a fracture that is not healed appropriately. I also have interest in treating nerve conditions, so nerve compression such as carpal tunnel or cubital tunnel, as well as nerve injuries with the reconstructive procedures and treatment that needs to evolve to help the nerve recover. Another area that I have a lot of interest in is vascular disorders. So, for example, patients that have scleroderma or different conditions like that may have compromised circulation or may have symptoms from insufficient blood flow. That's something that we like to evaluate and then treat, and often can provide significant improvement for these types of conditions. So I like to try to get to know the patient and to know the patient's family. For example, if it's a child or if they bring a parent with them, really get a sense of who they are and what's important to them. And so the philosophy of shared decision making, meaning I give them information and then we decide together what's going to be the best treatment for the patient. And sometimes what's right for patient A is not necessarily right for patient B. And so being able to individualize the treatment for the patient to give them what they need and what they desire is important to me. What we do is not life or death generally, but it's improving the quality of life and being able to see someone get back to activities, whether it's crochet, whether it's work on their computer, whether it's design for an architect, or return to sports. Those types of things are the most gratifying things that I can do to help make a patient better.